Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me back again for this episode is Dr. Michelle Krohn, and joining us on the other microphone, physical therapist Katie Sandvig. Welcome, Katie and Michelle. Thanks for coming in again.
Thanks for having us.
Yeah, appreciate you guys talking about this. Now, last time you were in, Michelle, we were talking about infertility, which ended up being a much even more fascinating conversation than I thought it was going to be. I've learned so much already. But now I want to talk about something that I mean, infertility, everybody kind of has a general knowledge about. Pelvic floor, I knew nothing about coming into this, except for the terrible TikTok social media trends that I see. So, Katie, you're a physical therapist that's specifically trained in this sort of stuff. How irritating does that get when people come in and say, well, no, I know how to do these. I do them all the time.
I mean, honestly, most people that are coming to see me have already failed at trying to do TikTok things. So it's something very common that people talk about. You know, what do you think about what I saw on TikTok that talks about this or that? And I mean, I basically say, you know, I'm going to give you what you need to do, and I would, you know, take that advice, and you know, you can look at it and see what they say, but don't take it individually for yourself because everybody's different.
But while you're talking to me, you're going to put your phone down, and we're not going to look at those things. All right.
There are some good ones, though. I mean, I will say.
Oh, are there really? Okay.
I mean,
well, then maybe at the end of this, you can recommend some that people do, so they're not just randomly getting them. But I guess to start this, for a bunch of people that were like me coming into this, what is pelvic floor, and what does that mean?
Yeah. So the pelvic floor muscles are basically a group of muscles, and they're connecting from your pubic bone in the front to your tailbone in the back. So they sit like a big sling at the bottom of your pelvis, and they actually have a lot of functions. So the first function that we tend to talk about is just bladder and bowel function. So the pelvic floor muscles help to control your bladder, to help maintain continence, as well as to help you release your urine. So I always tell people they have to be able to contract in order to hold your urine in, and then they have to be able to relax in order to release your urine. And then also for bowel function, so same kind of thing. You want to be able to hold your bowels in when you want to hold them in, and release them when you want to release.
That's what that muscle is. That's what that's doing. I'm assuming it works the same for guys too in that instance.
Mm-hmm.
No kidding.
Yeah, so I treat both men and women for pelvic floor dysfunction. Obviously more common in women with birth and that kind of thing. But I treat a lot of men post prostatectomy for pelvic floor dysfunction.
Okay, now explain that. What is that?
So
for men, the word you said that now I can't say.
Right. I mean, we're kind of going to get way off, but we'll kind of go quickly. So,
sure. Yeah.
So when men have prostate surgery, basically the prostate is removed, which affects their bladder function.
Okay. So are there numerous types of pelvic floor dysfunction? Or is it pretty specific? I mean, is it a common thing, or can there be a bunch of different things that can happen with that?
Yeah, so pelvic floor dysfunction is a very, very broad term.
Okay.
There's a lot of things that can happen. So, so going back to the functions of the pelvic floor, we talked about bowel bladder control. The pelvic floor also helps just with our stability of our pelvis. So it's kind of like the core of our pelvis, I tell people. And so if we have weak pelvic floor muscles, we can have instability in our pelvis as well as in our lower back, which can cause anything from lower back pain to hip pain, pelvic pain, all those kinds of things.
So okay, kind of going back just a little, is it a pretty big muscle then? I mean, is it a pretty big?
Yeah, so it sits on the bottom of your pelvis.
All of that, yeah.
Yeah, and there's 3 layers of muscle there, so it can do quite a bit there. So yeah, there's the stability function. There's also the support function, which we were going to talk about. The pelvic floor supports your organs. So in women, it supports your bladder, your uterus, and your rectum. And so kind of getting Michelle into this a little bit.
Pelvic organ prolapse is actually the biggest problem with the pelvic floor.
So explain that.
Yes. So there can be weakness that can cause any of the walls of the vagina to prolapse. Actually, the bladder is the front, the uterus, or what we call the top of the vagina if the uterus is absent, if somebody had a hysterectomy, or the posterior part, which is the rectum. And all of those things can bulge and cause symptoms. And actually, there's a lot of women that have minor prolapse that are actually asymptomatic from it.
So here in a little bit, I want to talk, there's obviously going to be ways to make that muscle stronger, correct? Or make it work better to prevent something like that. Because that just sounds horrific for something like that to happen.
Yep.
I mean, when it does, I don't want to linger on this too much, but oh boy, can it be something really serious that I mean, you've got to get in right away then,
Yep. So
right?
the only time it's really serious is if somebody is unable to void. So you actually can get like an obstructive uropathy where you're unable to void because the prolapse is so bad.
Oh, so then what? How is it treated? And is there surgery that needs to be a part of this?
There's stages of prolapse. So there's very mild prolapse where usually women are asymptomatic, don't even know they have it. And then there's stages where it becomes more symptomatic, where they have pressure symptoms, or like we talked about, voiding dysfunction, bowel dysfunction, that kind of thing. And really what we say you need treatment is when you're symptomatic. So women that don't have symptoms don't need treatment. When they do have symptoms, there's a range of treatment options. So first line, what I always recommend is physical therapy, unless it's severe prolapse that can't be helped with that. So I think physical therapy plays a very important role in that. There's devices called pessaries, which are actually little different shaped devices that go on the vagina and push things up. And women can maintain those on their own, or they can come in and we maintain them for them, or surgical management.
Is it, you mentioned that it's pressure and issues with voiding, but is it painful too? Is it something that can be painful or not generally?
I would say most of the time it's not terribly painful, but women can have pain from it.
Okay. All right, Katie, let's go back to you had one of the things you had mentioned was incontinence. Mm-hmm. Is there different types of that when this happens?
Yep. So we kind of classify it as 3 different types: either stress urinary incontinence, urge urinary incontinence, or mixed, which is both. Stress urinary incontinence is the type of urine leakage when you cough or sneeze, or a lot of women when they try to exercise, running, when they have leakage with those types of activities. That's called stress incontinence. The urge incontinence is more of you have a strong urgency to go to the bathroom and you're trying to get there and you don't quite make it.
So I know sometimes too you will see, and I think this has to do, that muscle must get weaker than too with having children, right? Because you'll see, again, I keep referencing back to social media and a lot of this, you'll see women making fun of that. Like when they sneeze, and then they have to go to the bathroom. That's exactly what you're talking about here, though, correct? Mm-hmm. And is there, what role then does physical therapy kind of play in this to fix that or make it better?
Yeah, so there's a lot of research that's been done specifically on stress incontinence and the ability for your pelvic floor muscles to get stronger and be able to control that. I'm able to treat both stress and urge incontinence in the clinic. They're treated a little bit differently. My patients with stress incontinence, we work a lot on just really the activation of the muscles, being able to kind of quickly respond to those types of activities. So I teach them to try to activate their muscles prior to coughing, sneezing, those types of things.
How does that work then? Can you, it's kind of hard to, as you're talking, but what do you tell them to do with that muscle?
Yeah, so I use a lot of breathing techniques.
Okay.
So the pelvic floor is very linked with the diaphragm. And so I actually have people try to exhale and contract or lift their pelvic floor. So I tell them everybody kind of needs a different cue, but I say various things like stop your flow of urine. Sometimes I say pick something up with your vagina. It just depends, like everybody kind of has a different cue. What I utilize what's called biofeedback. So I use a pressure sensor, either vaginally or externally, on the pelvic floor muscles, so that when they contract their pelvic floor, I can see on my screen what they're doing.
Is that kind of like is it kind of like a TENS unit? Is it something like
Kind
that?
of,
Similar like that?
The external...
Look, I love the fact that your eyes got big and you're like, hey, he said something. He's listening. So
I mean, basically the electrodes that I use for the external sensors for the biofeedback are the same. They're smaller, but that you would use for that type of a thing. And then they hook to cords that hook to my computer. So the patient can visually see on the screen what their muscles are doing, which is extremely helpful to be able to know if they're actually using the right muscles.
Yeah, I suppose any visualization of that.
Yeah.
Because anybody can say, well, do this. And you think you're doing it, and maybe you're not doing it correctly.
Right.
Oh, that's a pretty cool tool.
Yep. So we use it to treat both incontinence and prolapse, as well as various other conditions. So.
Okay. Now let's go back to pregnancy a little bit, and how that affects that muscle. I know, Dr. Krohn, you and I were talking earlier about, the more kids that women have, then that muscle, it's surprising to me because it seems like, when you use muscles more, they get stronger. But when it comes to childbirth, that seems to be quite the opposite then, isn't it?
It's actually, not even childbirth. So women that have C-sections can also have pelvic floor dysfunction.
Yep.
So it's the increase in intra-abdominal pressure from having a pregnancy that puts that pressure on the pelvic floor that can affect that. But then, of course, a vaginal delivery also can affect that even more because there can be tearing of those muscles. Obviously, they're stretched.
Is that common? Is tearing common?
Tearing is pretty common, yeah. So it's a group of muscles that are involved in the pelvic floor, and so some of those muscles can be torn with a vaginal delivery.
So when women are pregnant and they want to maybe understand these risks, then they come to you, Katie, and then what do you recommend for them during their pregnancy?
Yeah, I love when women come to me for just preventative pelvic floor training when they're pregnant, because I can help them understand where their pelvic floor is and how to use it while they're pregnant, which in turn really helps them in their recovery postpartum. So I teach them how to do pelvic floor exercises. I teach them how to do breathing exercises. I actually do a lot of education further along during their pregnancy on how to relax their pelvic floor, because that really helps assist with delivery. So we not only work on kind of, how do you strengthen your pelvic floor as well as your other core muscles during your pregnancy, but also being able to relax those muscles when you need to.
Okay. Now, after then the child is born, obviously you want to continue the practice of this, correct? And one other question I had here in my notes, and let's see if I'm saying this right. Is it diastasis recti?
So there's a lot of close. There's a lot of different pronunciations of that. It's either called diastasis or diastasis. It's kind of pronounced both ways.
I suppose. Okay.
But I tend to say diastasis.
So
recti.
So do I.
Okay.
Well, that's how I'm going to say it too. What is it?
Yeah. So basically, in your body, you have kind of your six-pack muscles.
Yep.
Those muscles kind of run linearly down, and there's a ligament in between them called your linea alba.
Hold on. Yeah, I got it. Yeah,
They're right so there's
there.
A ligament.
Yep.
So when your belly expands, those muscles separate, and that there's more space between them, and that ligament kind of expands and stretches when you're pregnant, or even with men if they have like a bigger abdomen, that can happen. And it stretches, and then after you deliver, sometimes that doesn't come back together very well. And
the ligament is generally the problem, kind of in there, or is it the muscle?
Well, it's the stretching of the muscle, which in turn kind of stretches the ligament in the middle. And so that's supposed to happen. That's normal. Your abdomen has to stretch in order to allow the baby to grow. But sometimes after delivery, the muscles don't quite come together like they should. And so when there is kind of still a gap there, they term that diastasis recti. Now, I'll preface that as there should be somewhat of a gap there, always.
Okay.
But when it's greater than a certain distance, that's when we kind of diagnose that.
So this is something you can treat, though, when they come in. Mm-hmm. What's the process? What do you do for that then? I can't imagine that it's similar to the pelvic floor exercises, is it? Or
it's
is
very
it
similar.
Really?
Yep.
Okay.
So I always start with the pelvic floor.
Okay.
Because that is the base of your core. And so I always train the pelvic floor first. And then I add in kind of the deep abdominal muscles that are underneath those rectus abdominis, or those six-pack muscles. We kind of try to train our inner core is what I term it.
The inner core.
The inner core.
Now, okay, so let's say you're trying to get in shape. And are these muscles that you can focus on?
Absolutely.
In training, is it really?
Yes.
So what do you got to do? Maybe you say crunches. You're going to say burpees or something. I don't even want to talk about it anymore.
It's very complicated.
Good. Because if it's complicated,
it's a very gentle motion. I always say it's a gentle drawing in motion. So it's like you're doing a pelvic floor contraction or a Kegel.
Okay.
But you're coming up further into your lower abdomen, and you're just gently drawing inward.
And that's
the muscle called your transverse abdominis muscle.
Okay.
And that's one of the muscles that I try to train for people with diastasis.
Oh, well, are there exercises like let's say you're planking? Does that do anything for those kind of muscles?
So basically, I start out really basic on your back, and I get people to activate those muscles first.
Okay.
And then I start adding in all the other exercises.
Okay.
So basically, you can do that muscle contraction and improve that diastasis with various exercises. You just have to engage the correct muscles.
And obviously, the more you do it and the more you train, then the better it's going to be. I mean, inevitably, right? It's something you would highly recommend.
Yep.
Okay, now, you mentioned the word Kegel, all right? And again, this is one of those exercises that you will see all over social media, and TikTok for a while was all over it too. Is this a thing? I mean, is it an exercise, or is it more just for clicks,
So, I mean, Dr. Kegel was a guy who developed a pelvic floor muscle exercise called the Kegel.
Okay.
So, very long time ago.
Yes.
So you can term a pelvic floor exercise a Kegel if you want to. I tend to not. It's basically any pelvic floor exercise is a Kegel. It's a contraction of your pelvic floor muscles.
See, and most people mostly they turn it into something sexual when it's on a lot of the social media.
Yeah.
But the way you describe it is no. It's more for that. I mean, it can be maybe.
Your pelvic floor muscles have sexual function.
Okay, sure.
So we didn't get to that part of
the function.
It has so many functions.
I'm learning so much here.
That's awesome. Okay, so I mean, maybe if you're comfortable with that, kind of speak to that a little bit about the sexual functions it can work along with that.
Yeah, absolutely. There's a lot of research showing that stronger pelvic floor muscles or better activation of your muscles can improve orgasm in intercourse in both men and women. So
so that's not just for clicks. There is actually something behind it.
Yeah, there's evidence of that. Yep.
Awesome. Mm-hmm. Now, before I let you go, Katie, we were talking with Michelle too in the last podcast, and she told me that she has playlists that she uses when she's in surgery, right?
Okay.
Now, when you're doing these kind of exercises, is there music or playlists or things that you listen to that you like to listen to?
When I'm doing them, or when my patients are doing
either
them?
One. When you're doing the exercises, what's your go-to for music? What do you like to listen to?
I mean, I like to listen to music when I exercise,
right?
But it doesn't really matter.
Really, it can be like anything. Okay.
So is it quiet in your office?
Yeah, I do not play music while my patients are doing pelvic floor exercises, because we are typically in a private treatment room, and I don't have a boombox in there or anything.
Okay.
You know?
Well, then I guess really the most important question to ask of this whole podcast. Michelle says that she's not a country music fan.
Oh, see, I knew this was coming
So,
somewhere.
Katie, what's your take on country music?
I enjoy country music.
Well, we'll be happy to have you back again sometime, Katie. Michelle, it was nice talking with you, but I think we may be done. So, well, that's awesome. That's perfect. So, I mean, all of this stuff is what I like about this is a lot of this can be preventative in a lot of instances. You know, we talked about we talked about the infertility and things you can do to help that, and this can this pelvic floor and these exercises, can that make a difference? I mean, in some small instance with infertility as well?
I would say the only time is if there's a sexual dysfunction.
Okay.
Especially if women have pain with intercourse, it's going to limit the amount of intercourse that they're having, and it can affect them getting pregnant.
So this all kind of ties together.
Yeah.
It's perfect.
Yeah.
And you guys obviously work well together. You're sisters. I don't know if we talked about that. So maybe you could kind of tell as we were talking here too. But it was so nice to meet both of you. You guys were awesome at this. Thank you so much for coming down. Dr. Michelle Krohn from Monument Health in Spearfish, and Dr. Katie Sandvig, too, a physical therapist here in Rapid City, right? Thank you both for coming in and talking.
Thank you.